Hi, my name is Dawn Powell-London, and I'm an acupuncturist at the Lutheran Spine Center. And I'm here to talk to you about how to refer your oncology patients to the Spine Center for acupuncture. What you need to know to refer patients for acupuncture. So the first thing that you need to know is that you don't need to completely understand how acupuncture works. No one really completely understands how it works. Our current technology is really not fit for measuring acupuncture outcomes. A lot of the studies that are out there use 1 or 2 acupuncture points, and generally that's not how an acupuncture session would go. You'd have at least 10 to 20 points in your body all over, not just 1 or 2 points. But it's easier to measure 1 or 2 points rather than a whole session of acupuncture. The second thing that you need to understand about acupuncture is the number of visits required for results depends on the length of the condition. I prefer to treat patients, especially oncology patients, preventatively. Chemo, radiation, surgery, those are things that it works better if we could treat them before they start having symptoms. I like to see results in the first session, but it may take a few sessions. Chronic conditions require more time. The third thing that's really important for you to understand is that acupuncture is thousands of years old. There's evidence of acupuncture tattoos found on the Ötzi Iceman mummy that was discovered in the Italian Alps, and he's 5,300 years old. Our current texts that we use for acupuncture date back to 3,500 years ago. So it's got a lot of history and a lot of evidence behind it that help to support being able to refer patients. And acupuncture works. There's thousands of years of use behind it, and if there was nothing to acupuncture but placebo, why are there so many professions using acupuncture and calling it their own? PTs, chiros, MDs, they're all using dry needling, which is an acupuncture technique. Acupuncture versus dry needling. Dry needling is not how acupuncture feels all of the time. Sometimes it is an acupuncture technique that an acupuncturist would employ. I am personally very grateful for dry needling because it has helped promote acupuncture and make it more acceptable. But acupuncture is so much more. Wait, acupuncture is so much less than dry needling, much smaller needles. Dry needling generally uses 0.30 millimeter thickness needles, whereas acupuncture needles range from 0.10 millimeter thickness to 0.25 millimeter thickness generally. And there are lots of ways to make acupuncture much less painful for someone that is needle phobic. If someone is freaking out about acupuncture needles, I am not going to stick the biggest needle I can find in them. I can use different techniques. I can use smaller needles. I can use press needles. I can use the acupressure seeds if they're totally freaking out about the insertion of the needle, just to get them eased into it. Acupuncture for symptom management. Acupuncture can treat many symptoms involved with oncology patients. Acupuncture is very well known for treating pain. Many different types of pain, many different causes of pain. With oncology patients, we're looking at pain caused by the cancer itself or from the drugs that they're taking, the treatment that they're taking with radiation or surgery recovery. Quiz time! Approximately what percentage of patients with cancer experience pain at some time during their illness? A, 30%, B, 50%, C, 70%, D, 90%. The answer is C, 70%. In a 2016 meta-analysis of pain prevalence in patients with cancer, 66.4% of the patients with advanced metastatic or terminal disease reported experiencing pain. 36% of those patients in the previous study remained in pain after oncology treatment ended. Let me give you a couple examples of patients that I have treated at the Spine Center with back pain. Peggy had breast cancer surgery and was having horrible thoracic pain for a year and a half after she had her surgery. It would not go away with PT and pain meds, but just a couple of acupuncture sessions and she was pain-free, and she'd been dealing with a 7 out of 10 pain for over a year. Steve, name changed, had chronic low back pain. He had survived brain cancer, surgery, and radiation and was given 6 months to live. There was not much they could do in terms of treatment for his lower back, and the medications did not help. It's been 12 months and he's still alive and causing trouble, but his back pain is much more manageable with acupuncture. Besides pain, acupuncture can treat many other symptoms that arise from oncology treatment. Insomnia, the interesting thing with that it also improves cognitive outcomes with improving the insomnia. Night sweats, hot flashes, it helps to reduce those greatly, and most of those symptoms do not return. Acupuncture can also treat depression, neuropathy, nausea, vomiting, chemo side effects, radiation side effects. Here is a list of other things that research has shown acupuncture to be beneficial for: insomnia, fatigue, head and neck oncology patient symptoms, nausea, vomiting, oncology pain, aromatase inhibitors pain, neuropathy, sweats, hot flashes, bladder issues, radiation side effects, surgery recovery, cardiac issues, depression, chemo side effects, and acupuncture in combination with other drugs to improve outcomes. I think that's the most exciting thing for the future with acupuncture, is being able to show acupuncture does help the drugs work better. I do have a handout that works better online so that you can link to the research that's out there about different conditions that acupuncture can help with oncology patients. Referral logistics for acupuncture. To get started, Epic is the fastest method to get a patient a referral. It's an internal referral, and SCLHFRLM acupuncture is what you need to type in, and then you can look up my name, Dawn P. Londano, and then diagnoses and the name of the referring provider or physician. So the patient does not need to contact us. We will contact them after our referral coordinator looks into their insurance. And it comes up on her Epic work queue when you type in that SCFR acupuncture. And then she will look into their insurance and see if it is a covered benefit with their insurance, and she'll call the patient to schedule. If they do not have acupuncture benefits, then the cost will be between $65 and $85. Closing. Honestly, the biggest thing that I treat is pain, but pain comes in many different forms, physical and emotional. The pain can be from drugs, it can be from surgery, it can be from radiation, it can be from just being freaked out that you have cancer. I believe that not everyone is a great conductor for acupuncture, but it is definitely worth a try. I do believe getting ahead of the symptoms really helps prevent them. There is some research that's out there with this in mind with radiation side effects. It's very exciting to see that coming around. And if nothing else, acupuncture is a great way to take a nap. My name is Dawn Powell-London. I'm a licensed acupuncturist and I work at the Lutheran Spine Center. I've been with SCL Health for over 15 years. I just completed my doctorate in acupuncture after practicing acupuncture for 19 years. Thank you so much for listening, and I hope this will help with your being able to talk to patients about acupuncture. If you have any other questions or if patients have any other questions, they can contact me probably best by email, feliciadawn.powell-londano@sclhealth.org. You can try calling me, but it's not always 100% that I will be able to get back to you right away. I work kind of long hours, so it might be the next day before I can get back in touch with you that way. But thank you so much for listening and watching this presentation, and I hope this helped you be able to refer patients to the Spine Center for Acupuncture. Thank you.